The prices of medicines globally may be expensive and unaffordable to many. In Nigeria, the situation is the same, making it difficult for people to access basic medical services. And that's why some Nigerians chose to patronize private practitioners and private centers where they can be sure of quality of medicines and quality of services. Faced with a high level of poverty, only very few Nigerians are able to visit the expensive private hospitals for quick medical attention, preferring instead the cheaper alternative government hospitals offer. The availability, affordability and accessibility of essential medicines to the populace, irrespective of their income status, is critical to the success of any healthcare delivery services. For a start, irregular and most used drugs such as painkiller, a card in a general pharmacy sells between 100 naira to 200 naira, while in a private hospital pharmacy, it goes for as high as 300 to 500 naira. Roots TV Nigeria went to town to find out why the huge difference in the prices of drugs and if they are readily available for Nigerians.
Yeah, sourcing for drugs is actually a very huge problem. Why? Because there are, if you take anti-malaria for instance, there are a million of such out there. So you maintain your source, of drugs directly through the pharmaceutical reps. Okay, most of them are tested, drugs, and sometimes based on report from patients, these drugs are really working. You maintain such supply, and anyone that you have seen either complaints from patients or you have seen that is not giving you the result you want, you stop sourcing your drugs from them. So there are companies that you keep tabs with and get your source of drugs from them, and once they have worked for you, of course, sometimes you go specifically for the drugs we call branded drugs.
Patients in Nigeria pay up to 2 to 64 times more for medicines than the international price of medicines in various facilities. This is sometimes due to importation costs of the drugs. Private health clinics were shown to charge up to 184% more than the public health facilities and 193% more than private retail pharmacies. For example, amitriptyline from a private clinic costs up to 650% more than when obtained from a public facility or private pharmacy. The private sector practitioners believe so much is spent into importing original drugs, and as such the cost is factored into the retail sales. According to the 2017 World Health Organization report, in the West African sub-region, approximately 60% of drug manufacturing takes place in Nigeria. There are more than 150 pharma formulation manufacturing facilities, as the pharma industry is growing at 13% yearly, with an estimated market size of $1.8 billion.
And if the patient requires better drugs, they are written out for them by outside. NHIS generally frowns at that. The HMOs frown at that. But of course, there's a list of drugs that are covered for each particular platform of NHIS. So if you have drugs that are not covered for that platform, they'll be written out for you to go and buy outside. But if you have drugs that are covered, and some patients will even tell you, please, doctor, forget my NHIS. Just write the drugs will cure my ailments. Those categories of patients, you want to go for, the bigger drugs that might work better, than the other, very lowly drugs.
Nigeria's current economic status quo is already burdened with debt, but there are ways around it. Restructuring our health system is ultimately essential, but without adequate financing, we may never create the health system that works. Roots TV, Abuja.